again, big question, very hard to talk in general terms because it depends on the person. That's why you're better off having a consultation. Again, lots of people look for answers online, and you can't get answers online. You can just get opinions, and sometimes people can be very opinionated and say, yeah, this is the best way to do it, just because that's the way they had it and they had a good result, or this is a terrible way to do it because they had it that way and they had a bad result. It doesn't necessarily mean the way is bad. It might just be their result. So broadly speaking, question to answer is what size bra do you wear? Are you happy with that size of bra? So if your breasts are deflated, you've lost volume, and you're happy with the bra that you're wearing a C cup bra or a D cup or whatever, and you're happy with that. But when you take your bra off, your breasts sag. Then if you're happy with that bra, I would say to you, you don't need implants, because this patient is saying, I'm worried about implants, which I can totally understand. If you're happy with the size of your bra, you don't need implants. If you're a B cup and you want to be a double D or a D cup or something like that, then you do need implants. So implants are really good at adding volume. So implants are for the volume, for the cup size, making the cup size bigger. The lift is for the shape. So if it's predominantly one problem, whether it be just predominantly shape and not that bothered, you don't want them a little bit bigger but not much bigger, then I'd say go for a lift. If it's predominantly volume and not so bad on the shape, look, I'm happy that the shape, they're sitting a bit low, but I'm not that bothered by that, and they're not too low, but they're really too small, then you could maybe just have implants. And that's the way I usually advise people to go, to try and maybe have one if one's a predominant problem. But if it really is the shape and the volume, if they're sitting low and they're too small, you want them bigger and lifted, that's when a lifted implants combined comes in. I hope that, yeah, I hope that sort of answered it. And really, you do need an examination to see whether you need a lift or not, because some people really do need a lift. If your breasts are sitting really low, then you do need a lift, and whether you have implants or not is your choice. But a lift is a given. If your breasts are sitting really low, you can't just have implants, because they'll just still sit low, and your implants will be here, breasts down there. That won't look good. But if they're not too low, then you might be able to get away with just implants if you did want to be significantly bigger.